Heart disease remains one of the biggest killers in Oklahoma. According to the American Heart Association, Oklahoma has the third highest death rate from cardiovascular disease in the country. A new state-of-the-art laboratory at the OU Medical Center is bringing cutting-edge technology to bear on heart disease, providing new diagnoses and treatments for Oklahomans needing urgent cardiac care.
Officials at OU Medical Center officially opened the $20 million cardiac catheterization and electrophysiology laboratory this week. The 20,000 square foot lab features innovative technology that gives the facility greater capacity to diagnose and treat heart attack and stroke patients. OU Medical Center System CEO Chuck Spicer says the lab's design and the collaborative involvement between cardiology, electrophysiology, and other specialties will enhance the quality of care for patients.
This will be a heavily utilized area on the part of the medical staff. Six different specialty groups will access and work in these procedural areas.
Chief of Cardiovascular Services Dr. Dwight Reynolds says the new lab has several suites designed to accommodate a variety of procedures.
There's been a very important focus on integration of services that is specifically designed to make our patients and their families have a much better place to be taken care of.
During cardiac catheterization, a long flexible tube is inserted into a blood vessel, often in the groin, and threaded up into the heart. Doctors could then use the catheter to perform diagnostic tests and provide treatment to patients.
We're looking for any sort of blockages in the heart and the vessels that surround the heart that can have plaque buildup or any areas where there's not getting adequate blood flow to feed the tissues. And we go in and we open those up with balloons and stents so that we can revascularize the heart.
Patricia Johnson is supervisor of the cardiac cath lab. She says 3 of the labs feature hybrid technology, allowing them to be converted into a fully functional operating room. That technology provides safer and quicker access to medical care for patients.
Anything that can happen in the OR can happen in one of these rooms as well. So if we have an emergency, we don't have to transfer the patient and package the patient up to take them to the operating room. We can do it all right there. The physicians will come to us. You don't have to move the patient and all the risks that come along with moving a patient. We can just dive right in.
Registered nurse Mark Macklin says that hybrid feature also gives doctors more flexibility.
We can undertake some procedures that typically would never even be considered in a percutaneous or in a cath lab setting, just because of the high risk involved in it. But it gives us the ability to do those procedures safely and efficiently.
The labs will also be able to perform electrophysiology studies to detect and treat irregular heartbeats. In electrophysiology, electrodes on the end of the catheter gather information on the heart's electrical activity, which doctors can watch on EKG monitors. The labs also feature state-of-the-art equipment to give physicians continuous information about the patient's condition.
This big screen you see behind me actually will allow you to have multiple inputs to incorporate ultrasound, CT scan, X-ray images, and all that into one screen, so you have all the data in front of you. Will allow you to do better determination of the problems and more accurate assessment to be able to help your patient better.
Dr. Mason Abu-Fadel is director of Cath Lab Intervention Cardiology at OU Medical Center. He says the diagnostic equipment in these labs will provide ultra-clear imaging while keeping both doctors and patients safer by delivering lower doses of damaging X-ray radiation.
So the patient, even in complex procedures where they have to go for a long time under the X-ray machine, they still have a much reduced radiation dose compared to the older machines.
Registered nurse Fred Strawn says another benefit of the cutting-edge technology is the shortened time necessary for patients to undergo procedures inside these labs.
Which reduces the amount of time of general anesthesia, first of all, the amount of X-ray exposure as well, and just the amount of time that the catheters are actually in the heart, which it carries some risk as well.
The lab, which has been more than a decade in the making, will open its doors to patients later this month.